Today we want to look at a dashboard that we contributed to the construction of, but was built by Bancroft and Fina Nash and her team. And just as a preface, Fina, and she introduced herself earlier, if one thing kind of has punctuated our time here at Pinnacle over the last several years has been the input that Fina has made to all of our processes, whether it's the financial processes or the service processes. Fina is always thinking one step ahead of us and thinking of new and interesting projects. We're so fortunate to work with Fina, and her input is invaluable. And so when we have had an opportunity to support her and her team in building some COVID-19 tools, we jumped at that chance, and we're really honored, and it's a privilege to be part of that effort in a way with her team. Her team did the lion's share of this, of course, and you'll see that they've done quite a bit of work. So with that, Fina, we'll hand it over to you, and I can advance these slides, and we're just really looking forward to having you and appreciate you taking the time today.
Thank you, Sean. And I really can't say enough how much Pinnacle and Sean have helped us put this together, and it's been a game changer for our organization. As I was telling Sean before the call today, we've convened a COVID task force at Bancroft that's from about 20 people across the organization in leadership roles, and we meet every day at noon. We have a call, and one of the things that we do is we go over the dashboard that you're about to see, and it's really helped, I think, I don't know if this is the right word, but like comfort people in that we are data informed and that we can make decisions, based on the data that we're looking at in the dashboard. So, I think it's a little bit of a reassurance, and also just being able to act on things. So, the reason we started this dashboard is because very quickly, as we've all been responding to the COVID pandemic, we realized that we really needed to be as predictive as possible for potential COVID cases and at our locations, and in order to prevent the spread of it. So that's really how we utilize these dashboards is to be predictive and to prevent spread. Just to give you a little bit of background on Bancroft, we're located primarily in New Jersey. We're kind of sandwiched right between Philadelphia and New York. So you can kind of visualize us kind of right in between those two. And we also have some locations in Pennsylvania and Delaware in the Philadelphia area. And so we have 2,700 staff that work for us. 80% of the staff are direct care professionals. And we have 750 individuals that live with us residentially in about 200 group homes or campus locations. So that's just a little bit of context. So as we start looking through some of the numbers and some of the dashboards, just high level to keep in mind, in terms of staffing numbers and residentially served individuals. Okay, so this is actually the first dashboard that we created very quickly as the COVID pandemic started hitting the news, and we realized it's affecting the entire country, but being outside of New York and Philadelphia, we realized that this was gonna be heading our way very quickly. One of the things that our organization started doing was to make sure that we had a good process and protocol in place to get our staff to screenings through our occupational health department. So a lot of communications have gone out to the staff on a daily basis. If you feel like you exhibit any symptoms related to COVID, contact the occupational health. There's 3 different numbers to contact them, or you can go on site and get screened. So this dashboard that you're looking at here is really managed by the occupational health team, which is a group of nurses. And when employees at Bancroft contact them, they go through a screening, and the screening, has probably, like, if you've been to any doctor's office or anywhere else recently, it's like, have you had a fever? Have you had respiratory symptoms? Have you been out of the country? Those types of questions. So the OC Health team assesses each employee that comes in, and then they categorize them into a particular status. So some of them are asymptomatic, as you can see here. Some of them are symptomatic if they have, like, respiratory issues. Some are referred for testing, and then when the testing comes back, they update the statuses to either testing confirmed for COVID or testing negative for COVID. And we just recently added, as of yesterday, a return to work card for those that specifically have been tested confirmed, to see when they actually come back to work. So underneath each of those cards, it shows all of our service lines that we're tracking, so that every service line leader can see how many staff are in each of these statuses that have gone through the OC Health screenings. And then we're also tracking the out of work by service line. So how many staff are out of work due to COVID-related screenings, not necessarily because they're confirmed or things like that, but according to OC Health, there's all sorts of reasons that staff might be out of work, mostly because they're symptomatic or things like that. And then how many screenings OC Health is doing per day. You can see we started probably early March, the screenings, and how many staff are currently out of work, over the time frame. So, like, for instance, right now, I think Sean took this snapshot at noon today, so we have 44 staff out of work because of COVID screenings at Bancroft.
Hi, Fina. This is Bob. When you test people and so you've got testing confirmed and tested negative, do you remove those people from the symptomatic column, or are those included in that?
They're removed, and that's a great question, Bob, because this is actually a question we get repeatedly asked when we go do the dashboard review at our noon calls. All of these cards and statuses are mutually exclusive. So if you're in testing status, you're not in the symptomatic column. So symptomatic is like, the OC Health is thinking something's probably not right, and they put you in symptomatic. If they progress to the point where they feel testing is required, then they would move over into the testing column. And then if, once they're tested, if they're either confirmed or negative, then they'll move over to that. So these are all actually unique staff, and they're not counted in more than one status at any given time.
Okay. Also, the out of work, is that just out of work due to COVID or symptomatic?
Yes.
Or is it also people that have taken advantage of the family leave due to COVID?
It could be that too. So it's basically anything that is due to COVID. Some staff are, have concerns about going into work because of COVID, and if they're, if they've contacted OC Health and gotten screened, and they said, well, I have a doctor's note, or I'm not, I'm not going to come into work, then they're tagged as out of work. They would be counted as out of work, not necessarily because they have symptoms or or they're in testing.
Okay, great.
So
this is fantastic. Yes.
Thank you. So, so one of the things in terms of getting back to the whole purpose of being predictive so that we can be preventative, as we look at this dashboard every day, one of the things that we ask our leaders to do is, based on this information, consider actions around where PPE might need to be deployed, where cleaning needs to be requested, and how to communicate to to staff and individuals at the various locations. And so that really helps to kind of get in front of these three really critical actions that really need to start getting put into motion as people move through these different stages.
That's fantastic. Thank you, Fina.
Okay. So our next tab in our dashboard, this one is called Person Served COVID-19 Status. And as you can see there's the map of New Jersey. So you can kind of see where our service locations are. And we're only tracking persons that live with us residentially. We have a lot of individuals that live in their own homes, or they just come to day program or the schools or outpatient. But these markers on the map are specific to our residential locations, and they're only the residential locations that currently have some sort of status that we're tracking with respect to our person served, and we call the individuals that that we serve person served. So we're tracking 4 different statuses. This dashboard is specifically coming from our Harris CCP EHR. And we've actually made some changes very quickly to our healthcare and nursing sections of the EHR to be able to track some of these things as needed. Like we didn't have viral infection tracking kind of fields until recently, specifically for this. So one of the things we do is in our labs section, where the nursing team is tracking when our person served either are sent for testing if it's suspected that they may have COVID, and then once the testing is completed, whether they're positive or whether they're negative. So currently we have 4 person served that have tested positive so far of the 750 individuals that we serve residentially in our programs. And the way we built this this map chart is the color codes correspond to the color codes of the statuses. So we can quickly tell which locations are in testing, which ones have confirmed positive, and which ones have confirmed negative. Any questions about that?
Fina, this is Ginger, and I apologize. I should have asked you this when we looked at this before, but does this look at individuals who are working in those facilities as well, or is that in a different one, like for the map?
Yeah, this one is just looking at individuals that live at the residences, not that actually work. That is something that we could kind of look at integrating, is the data from our occupational health and which individuals have tested positive there and where they've worked, where their home locations are, versus what we're seeing here in terms of the persons that reside with us and what their testing statuses are. The one thing that kind of gets a little bit tricky for us is that some of our staff work in multiple locations.
Yeah, I was thinking that.
Yeah, so so we can track them to their home department, but if they do come up as confirmed, there's a pretty extensive protocol to do some tracing as to where they've been in the last I don't know how many days prior to being tested or being confirmed, and then which locations have they worked at, which staff have they been in contact with, which person served have they been in contact with, and all of this is done by our infection control team, and and they basically have to kind of retrace all of that. I think we haven't gotten to that level of sophistication yet in being able to pull all that data together from our HR system and our and our EHR and all that. But maybe when we have some free time sometime.
Yeah, sorry, I wasn't trying to add work for you. Ignore me. Go ahead.
No, that's fine. That's fine. So, so the way that our service line leaders use this particular, dashboard is they're not what, as soon as there's some a status of sent for testing, they basically assume it'll come back positive. And it doesn't necessarily come back positive, but they put a lot of things into motion. So, they ensure the program has the PPE, and they consider the isolation protocols. They make sure the program has been cleaned. They work with the infection control nurse and communications to notify all exposed parties and all of that. So again, trying to stay ahead rather than being very reactive when, something comes back and it's positive.
Very cool, Tina.
Was it difficult to take the data from CCP and then map it?
It was not. So since we have everybody assigned to a bed in bed board, we basically took our 200 residential locations, took those records out of the program units in CCP, and then my guy that does the dashboards, he basically he found some resource on the internet that like you could upload addresses, and it'll return like longitude and latitude coordinates for you. And you could do it like in bulk. So he was able to get the longitude and latitude coordinates for all of our locations like pretty quickly. And then he created basically a file of that, and that's how he's able to generate that map.
Nice.
We probably should mention too that I should have mentioned this is Power BI, and so we're using the Power BI platform to visualize that in the mapping functionality.
Okay, so I guess around March 27th, we put staff wellness screening protocols into place. And so anytime any Bancroft staff walks into any Bancroft location, we need to go through a screening process. And it's a form that you could do on your mobile device. And there's little stations with temporal thermometers. So in addition to answering some screening questions, you have to take your temperature. You have to record it into the form, and this form shoots the data over into a Google Sheet, which Sean has figured out a way to connect to, and then put it into our data warehouse. And so we're able to track how many staff wellness screenings are being done every day. It's amazing to see that we've had over 10,000 already done in a couple weeks. So it has like the typical COVID screening questions, like have you had a temperature in the last 24 hours? Do you have a current temperature now based on your temporal reading? Do you have any respiratory symptoms? Have you been in contact with anyone with COVID? And have you been outside of the US? So if anyone answers any of those questions in, to the right of the wellness screening box, the form immediately comes up. Once they submit the form, it comes up with a stop sign and says you need to contact OC Health. Here's the number so that you can get an OC Health screening. And this is really, again, preventative. If there's a staff that is coming in and they have some of these symptoms, we want them screened through OC Health. We want them tracked, and we don't want them working if their symptoms are not good. So this tells us how many screenings are being done per day, which is nice to see that it's pretty consistent. We're only halfway through today, so that's why it looks less than the previous 4 days, but we are kind of averaging around 1,020 screenings per day, which I think is a pretty good compliance rate, for people that are actually coming into work.
And Fina, does that do the dips coincide with the weekends? Is that like there's maybe more people at the facilities during the week doing services and stuff, and then the weekends are slower?
That's right. Yeah, those dips in the middle there are the weekend, and we also have a different amount of shifts over the weekend. So instead of like 8-hour shifts, we have 12-hour shifts. So so we have fewer people, fewer unique staff reporting to work on the weekends. They just work a lot longer shift.
Oh, got it. Interesting. Cool.
Any questions about this one?
I mean, you can see, how fortunate we are to have Fina as a resource and to be able to participate in some way in these projects. I mean, it's really a learning experience for us as well, and we're just really lucky to be able to play a little role in this, Fina. So thank you.
Okay, this one is almost identical to the one we just saw for the staff. We have an exact screening for our visitors. Of course, just like every other agency, we're not allowing like family members to visit currently, and we've really restricted who can visit any of our service locations. But we do have visitors, such as people coming in for interviews, for direct care jobs, or contractors, or outpatient healthcare workers, and those types of people, facilities, people that coming into facilities, cleaners, a lot of the cleaners are coming in and visiting, and they all have to go through the same wellness screening protocol. So we're tracking how many visitors we're getting, into any of our facilities and any of our homes, and if they are symptomatic, and if they answer to the affirmative to any of the screening questions, similarly to the staff screening form where they get the stop sign and say go to Occ Health. The visitors say you can't come into the into this location because you have one of the you've answered affirmatively to one of the questions. Just one more. Oh, two more. Okay, sorry. All right, so this one, I found that our CEO was tracking the number of confirmed cases in New Jersey on a spreadsheet one day. So I said, we can probably help you out with that, so you don't have to do that. We actually found New York Times has a database that is publicly accessible through GitHub, and it basically has all national data for confirmed cases and number of deaths from COVID. And so, Sean was able to pick the file up from GitHub. It gets updated once a day, by the New York Times, and then it gets brought into our data warehouse. And this particular slide or dashboard is just looking at the counties that Bancroft operates in. So if you look on the right-hand side on the map, like each of those markers represents one of the counties that we're in, and the circles represent how many cases are in the county as reported by the New York Times database. So you can see we operate up near New York City in the New Brunswick area and Princeton area, and then then kind of coming down across New Jersey, and then around the Philadelphia area. So this shows us the very scary trajectory of COVID cases, in our area.
Yeah, this is so interesting. I thought this was such an interesting use of data, Fina, that to pull that like publicly available data, and anyway, I think it's really a good use of that. So bravo.
Yeah, it is, and it'll be interesting as we, if we can reach a peak and watch as it goes down, we'll be able to see that very clearly on this graph. So yeah, I'm sure this is one that's gotten a lot of interest.
Yeah, we, when we discuss kind of when it's going to peak, and we're thinking it's probably going to peak in the next couple weeks. So hopefully, maybe like 3 weeks from now, we'll start seeing a decrease in these trends.
I hope so. Yeah, absolutely.
Okay, this is the last one, and this was actually the one that we put up, I think earlier this week or late last week. One of the protocols that was put into place very early once the pandemic hit, it was to start recording temperatures of all of our persons served into the Harris CCP EHR, and do them, record temperatures more frequently, so that we could see if there was any situations where any of the persons served had fevers. So that started, but we didn't really have an easy way to to alert the nursing teams or the individuals, the leaders of the programs, to see if there were any emergent issues. And this actually has turned out to be probably our most predictive and clear predictor of whether or not one of our persons served potentially has COVID or needs to be sent for testing. So what this is showing is anyone that has a temperature reading of 100.0 or higher in the last 14 days has a card on this dashboard. And what we're displaying is just their MPI number, their group home location name, and if you look at kind of along the bottom, if they have any kind of viral status, that is also showed. So the three along the bottom are confirmed. Actually, the two on the bottom right are confirmed positive. You can't see the whole thing. You have to kind of put your mouse over it, and then the one on the bottom left is confirmed negative. So it's actually very uncannily predictive once you see a spike like that in the temperature, that there's probably something going on, and that is really the early warning indicator for our program to really put a lot of protocols into place around PPE and cleaning and isolating and quarantining and whatever else that they do to really prevent any significant spread.
This is really interesting. I like how it's very simple, but it's also extremely clear and like you said, very telling and predictive.
Well, I think that's also an interesting point that I don't know if everyone is thinking about this. Probably other smart people are, that I just am now thinking of it. But, some folks run a sort of baseline, have kind of a low grade fever pretty often, like folks with other chronic health conditions. But if you were monitoring someone over time and saw a spike, that would give you a lot more information than just taking a one-off temperature once in a while, because you would be able to see if this is kind of their normal, or if this is, represents like a shift, which is probably really helpful.
Yeah. And so if you could see like the chart in the bottom kind of right middle, and you can see that their temperature reading stopped around March 27th or something like that. They've been in the hospital since then because they were actually confirmed with COVID. So we don't have any temperature readings for them from that point forward until they get back into program.
Now, is this Sheets data, Fina?
No, this is actually coming from our Harris CCP system, from the vitals record. So
okay.
Staff are taking temperatures, putting them right into the vitals, temperature record, and then it's going into the data warehouse, and we're getting that from like the healthcare cube.
Oh, perfect. Okay, excellent.
Yeah.
Okay. Anything else about that one, Fina, that you wanted to mention, or any questions?
Unless anybody else had any questions.
Well, thank you, Fina, very much. I just wanted to show a couple of the resources. I know there's several that they're bringing in internally that I haven't mentioned on this slide that Fina and her team are using beyond just what I mentioned here. But I just wanted to mention that we are getting that daily update from GitHub, that New York Times data, and we're bringing in the Google Sheets data using the OAuth and integration services, and then the data warehouse is another source. And then I think there's several others that you're using, Fina, in addition to those. Is that correct?
Well, all of the other, it's either one of those three that you have listed here. A lot of our forms, the data that we're collecting through forms for our occupational health, and our wellness screenings are through actually Google Forms that go into Google Sheets. So that's all covered with with the work you did to do the OAuth and integration services.
And that was really cool. That's something we've never done before, as well as the first item, the GitHub data. But it was really interesting to go get that, and that's a real valuable source. So I appreciate you thinking about thinking outside the box and asking if we could help with that, because that was a great exercise for us as well. So thank you.
And the technology works really great. I mean, we once we figured out all the authentication, and by we I mean Sean, figured out all the authentication, gotchas. Everything is working so well. I mean, the data. I think Sean has most of the data refreshing on the hour. So so our dashboards are current as of the previous hour, which is really great. I mean, people are looking at them, several times a day, just to make sure that things are on track.
Excellent. Well, thank you again, Fina. Thank you so much for your willingness to share that.
Yes, thank you so much, Fina. That was awesome.